Here in Germany, coronavirus case numbers are rising, and they are rising fast. For the 9th straight day, the country has registered record infection rates, prompting doctors and public health experts once again to sound the alarm. They're urging leaders to ramp up pressure on unvaccinated people, and the first states have started to heed their call.
Berlin, the latest state to leave the unvaccinated out in the cold. Bars, restaurants and cultural venues are now off limits to those who haven't had their shot. I'm not thrilled, of course, but I think it's important that we all pull together and also enforce compulsory masks and, of course, protect ourselves, including those who are most vulnerable. The so-called 2G rule is meant to stop rising COVID-19 infection rates and encourage sceptics to get the shot. Some politicians think the rule needs to be expanded. I'm firmly convinced that we need blanket 2G measures and more in order to get through the winter safely, especially for indoor activities. This pandemic is being driven by the unvaccinated, and we have to get the whole thing under control again. Otherwise, within probably 2 weeks, the number we have now in intensive care units will grow so much that we will reach our limit in Germany. The country's next leaders remain locked in talks to form a new government. They're considering tougher measures, including making vaccines mandatory for healthcare workers. One company, however, is taking matters into its own hands, offering employees a hefty bonus if they get the shot. Everybody who can prove they've been fully vaccinated by the beginning of next year will get a €5,000 bonus. Even if they're already vaccinated today, they can also look forward to the reward. And those who get vaccinated before then will benefit too. Bosses admit the offer is as much about protecting their workers as protecting their business during the Christmas season. If it works, it may just give Germany's political leaders something to think about in the face of stubbornly low vaccination rates.
For more, let's cross over to our correspondent Anya Scharfenhoff in Berlin. Anya, the infection rate is rising, and that's put the government in a tight spot. What action do we expect from them?
Well, Tommy, the current spike in infections has caught Germany at a bit of a tricky time in a way, because, of course, we're waiting for the formation of a new government, and that's left a bit of a decision-making vacuum in a way. But Angela Merkel is, of course, still in power for now, and she is meeting the heads of Germany's federal states on Thursday to thrash out a new corona strategy to address what's fast becoming really quite a dramatic situation. But in the meantime, many of the German states have already introduced their own new rules. We saw it there in Berlin, but also Bavaria, Saxony have introduced new restrictions for the unvaccinated, barring them from access to many areas of public life. Now, the parties that are likely to take over the government here in a few weeks' time are already discussing much stricter measures. They're discussing restrictions on public transport, possibly even a vaccine mandate for certain professions, like people working with the elderly or in nurseries, something that we haven't seen here yet. So it's not quite a lockdown for the unvaccinated like we saw Austria introduce this week, but certainly making life for the unvaccinated more and more difficult in an effort to sort of push people to reconsider and have the jab after all.
Now, Germany seemed to handle the early stages of the pandemic relatively well. So how have we got to this point?
Well, I think it bears repeating that these really are the worst figures we've seen and worst infection rates we've seen in the whole of the pandemic, the figures we're seeing right now. And although the situation in intensive care units is not quite as bad as it was during the first waves of the pandemic, it is in many areas that are worst affected. That's mainly the east and the south of Germany. Hospitals there are getting to their limit, are at their limit, many of them having to transfer patients, COVID patients, to less affected areas in Germany. But the main reason for that really is that just not enough people have got themselves vaccinated here. The full vaccination rate here in Germany is stagnating at around 67%. And that's quite a bit lower than many other European countries like France or Spain, and it's simply not enough. We're also seeing more breakthrough infections amongst the vaccinated now. That's because immunity is waning after the first shots. They really need to go out and get a booster. With winter approaching now, people are socializing indoors more, and that's why we're seeing figures shooting up like that.
Okay. DW's Anja Schaffenhoff in Berlin, thank you. For more on this, I'm joined by our political correspondent, Benjamin Alvarez-Gruber in Munich. Can you give us a picture of the general situation in Bavaria?
Good morning, Tommy. Yeah, we just heard about the situation in one hospital, but unfortunately that's not the only case. There are several hospitals here in Germany's second most populous state that have severe problems, not only with beds, but also with staff when it comes to treating COVID-19 patients. And it's important also to remember that the problem with beds does not only concern people with a COVID-19 infection, but also people, for example, that have a heart attack or a stroke. They could also need to wait for a bed. So it is indeed a critical situation in Bavaria, and that's why the state of emergency was declared last week as well.
And what is the Bavarian regional government doing to combat the rising numbers?
As I just mentioned, they declared a state of emergency. State leader, also the state premier of Bavaria, Markus Söder, said that this week is the week of truth, that people need to reduce their contact, and also with new measures that are in place starting today, there will be a so-called 2G rule, meaning that people who are either fully vaccinated or recovered from COVID-19 will be able to go to restaurants inside or outside, and also to hotels. And there will also be other measures, for example, for the Christmas market that you can see just behind me. They're setting up and preparing everything. There will be part of this Christmas market where only people who fully have been vaccinated or recovered from the virus will be able to visit. So that's why they are trying also to reduce movement, and their calls growing. They say that this Christmas market should even be cancelled considering the high number of new infections here in Bavaria.
And how did the situation escalate in this manner?
To me, I think there are several reasons for that. When we look not only in Bavaria, but also in Germany. So on one side, we have the vaccination rate, that less than 70% have been fully vaccinated against COVID-19 in Germany. Then, of course, we have the seasonal aspect of winter temperatures. Now 4 degrees here in Munich, meaning that many people stay indoors where the risk of an infection is definitely higher. Then we have a patchwork of restrictions in Germany, with some states going with this 2G versions and others taking a 3G approach, meaning that people who have a negative test can also go to restaurants or indoor places. Several health experts have been warning for this situation, but politicians also, let's remember that we had elections in September, said that it's fear-mongering, promised that there would not be a lockdown. So there are several reasons to explain that. As some health experts say, the only surprise is that people are actually surprised by the critical situation in Germany right now.
Okay, thank you. That's DW's Benjamin Alvarez-Gruber in Munich.